Okay, everyone. So I think we'll get going, and as others come in, you might hear a little doorbell every so often. So please ignore that. Just to say welcome to everyone joining our sixth talk of the Researcher Series by South Asian Women in Higher Education Network. For those of you who may be new to the series, I just want to let you know that my name is Dr. Rumi Begum. I'm a senior lecturer in nutrition and exercise science, and I'm based at the University of Westminster, which is in London. And my role here is really because I'm an events manager for SAWHE. I've been developing this research series and really creating this space for all of us to connect and to share information and ideas. As always, we want to let you know that our intention is not only to share research and gain knowledge, which is definitely a big part of this, but also for us to have that opportunity to hear about the different researchers, their story, and how they got to where they are. We encourage you to form new connections as a result of all of this, obviously, if it feels right for you. So please use the chat, use your microphones at any opportunity to ask questions, to connect, and as we go along this talk. So I'm now going to pass over to my co-host, who is Rashmi, who will introduce our speaker for today.
Thank you, Rumi. Good morning, everyone. I'm Rashmi Liyanage, a doctoral researcher at Liverpool John Moores University and the Sri Lankan country lead for SAWHE. So today I will be co-hosting this session with Rumi. A warm welcome to our sixth speaker of this research series, Professor Pooja Saini from Liverpool John Moores University. Pooja is a professor of suicide and self-harm prevention and a multiple award-winning researcher for her outstanding contribution to the field. Her research focuses on addressing mental health inequalities, improving early identification of risk, and supporting the evidence base for suicide prevention across clinical and community settings. Her work span population level epidemiology, service level evaluation, and implementation of research with a particular emphasis on enhancing pathways to care for underserved groups and improving responsiveness of mental health systems. Over the course of her career, Professor Saini had led and contributed to programs of research that highlights the structural, organizational, and psychosocial determinants of suicidal risk while championing co-produce approaches that foreground the voice of people with lived experience. Her scholarship is underpinned by a commitment to methodological rigor, knowledge mobilization, and translation impact, ensuring that research findings inform policy, practice, and workforce development. In addition to her academic leadership, Pooja co-hosts the Let's Talk Hoop, Ending the Stigma Around Suicide podcast series, which disseminates evidence-informed discussion and expert insights to wider audiences, supporting public understanding in reducing stigma around suicide and self-harm. We'll be sharing the podcast links in the chat shortly. So without any further delays, it is a privilege to introduce Professor Saini, who is also my doctoral supervisor. So over to you, Pooja, to tell us more.
Thank you for that lovely introduction and for telling me about this group, Rashmi, as well, which I was just saying I'm really, love hearing all the talks. I'm just going to share my slides for today. Hopefully this is going to work. If someone could just let me know if they're on okay.
Yes, it is, Pooja. It's working.
Yeah. Brilliant. Okay. And hopefully I won't talk too long. So hi, I'm a professor of suicide and self-harm at Liverpool John Moores University. And I wanted to talk today about my career, breaking silence, building hope, and my journey into suicide prevention. As I've mentioned to some of the other organizers, today I've focused on kind of my career, how kind of my South Asian heritage plays into my work, and also I've focused on some of the research I've done with South Asian communities as well, or about South Asian kind of risk factors. So I just thought I'd do a little bit of a timeline from when I finished school and just kind of my career. So I did a gap year in India after I finished school, just because my mum wouldn't allow me to go to any other country in the world, basically, because we had family in India. So she thought I'd be safe at least. So I did teaching there, which was great, and kind of showed me a little bit more about my culture. I went to boarding school for my senior years, and I went to private schools in England, so they were very kind of white schools, if you like. So once I went to university, I wanted a bit of a injection of my kind of culture. So I went to University of Leicester, where we've got all cultures, which was amazing. And I did my BSc there. I've just seen I put that on twice. I then worked in the Home Office with people who were asylum seekers. So I think that was kind of probably my first time I worked with people from more deprived groups, and kind of saw a lot of the realities that people might face. I then went on to get a job as a placement officer for children who were put into fostering and adoption. So again, I saw a lot about deprivation, and some of the other issues that go on in our communities. I was quite lucky that I grew up in an affluent home where, you know, I was kind of cocooned to a lot of the things that do go on within our communities and a lot of the health inequalities. So these two jobs really opened my eyes to a lot of that. And I worked as a healthcare assistant in hospitals, and I saw a lot of self-harm and suicidality in young people, and some young Asian girls, actually, where it was quite sad that they were safer in secure units than they were at home in their communities, because of abuse by some of the male family members. So I saw a lot about self-harm there. I wanted to be a clinical psychologist, but found it difficult to get a job. So then I went to do a master's at University of Liverpool. And I also then worked for a housing association, where I saw a lot to do with women who suffered from domestic violence. And I got that job because I could speak Urdu, Punjabi, and Hindi. So, you know, I used my kind of roots to get my first, I think, really kind of important support worker role. And I learned a lot there as well about how much domestic violence and just kind of a lot of cultural factors played into some of the mental health issues that women had, and the suicide ideation and self-harm that was prevalent. And also the pressure that I put on some of the young women who were growing up, who were born here, who were essentially caring for all their siblings and their moms a lot of the time, who were unwell. So again, a lot of reality in that job. I then went on to get a research job at the University of Manchester, because I was advised to get on the clinical course, and I've never left research, basically. I was offered a part-time PhD where I looked at suicide prevention in primary care, and that's kind of led to what my research has gone into. I then got a senior lecturer post because it was hard to get a fellowship, research fellowship. But at John Moores, I got a lot of promotion opportunities, and as you can see, I was promoted in 2021 and then promoted again in 2024 to professor. So if I think about my research kind of and the advocacy at LJMU, John Moores University, I realized I needed to have a real focus of my research. So the focus was on suicide prevention across different populations, and especially to do with rapid access to care for people. I did some work in cancer prevention, which really highlighted some of the barriers and stigma within South Asian communities for me. And I also, when I was on maternity, decided I'd train as a fitness instructor, because I found classes really boring and I love Bollywood music. So I trained to be a Bollywood fitness instructor, which I did for a few years. And with that, I started a women's in the community, a community interest company with other South Asian women. And we had an exercise component, and then we also had a health kind of awareness component to these 2-hour sessions once a week. And we'd have women from the local Muslim community come along and do exercise. And then we talk about things like postnatal depression or different cancer preventions. And it was really interesting how I knew some of the women had issues, but they wouldn't say it in front of each other. There was a lot of stigma. And also how much they asked to learn about male prevention so that they could go home and share that with their work. So that really kind of opened my eyes actually to some of the barriers and stigma that were present to do with mental health as well as cancer prevention. I then worked a lot on access to care and early interventions and culturally informed approaches for cancer prevention originally. And it was more to do with where the work was as well, where I could get research jobs. And then as I've progressed in my career and I'm leading things, I do a lot of collaborative work with NHS, voluntary organisations, and I keep in touch with South Asian community groups as well, as I'll talk about later. So kind of my, Asian roots and why this comes in. So I've grown up in a South Asian community. I think I've seen that kind of hardworking generation of our, I was in the kind of generation where people moved here in the 60s for work, at quite a young age, and left their families abroad and kind of were self-made business people. But I'd say over the years, I've seen stigma, I've seen the silence, I've seen domestic violence within extended family and how that's just kind of hidden or not really talked about. And, mental health wasn't talked about at all. I remember going to visit some people where their kids might have a schizophrenia diagnosis or something, and they're literally hidden away in a back room, as though, they're crazy or something. So it's just that kind of stigma. And I feel like that's definitely improved over the years. But there's still that kind of impact across generations about things not being discussed. And that's something I wanted to help reduce through my work. But the reality is, I've seen if I just focused on South Asian communities, I probably wouldn't have got as far as I did. And so I think there was part of my career when I realized I need to work my way up the ladder. And now as a professor, I feel like I'm coming back to those roots a lot more again, which I'll talk about later. So I'd say just in my own personal path, my heritage has kind of shaped my understanding of that, how much things are hidden. Also, how much religion plays a part as well, because a lot of the time people turn more to priests and, people who maybe can read your destiny and things. There's other ways that people cope with what's going on in life and some of the life pressures. But I've also seen over the years a lot of the academic, systemic kind of gaps for minoritized groups and more so for women, actually. And I think the gender hierarchies has just become more and more evident to me, some of the gender gaps in pay and some really simple things where I didn't expect that would still be happening, but it is. So I think over the years, I've also become a bit of an advocate. I was co-chair of the Women's Academic Network at Liverpool John Moores University, and I really, really enjoyed that role. I think I used to sit on the sidelines and kind of moan a little bit about things that weren't happening. And then I just thought, you know what, maybe I need to go and actually do something myself. And I put myself forward. And I feel like I really influenced, making sure that people like myself were on panels and coming to speak at events. And also they've been really well received and people have loved that kind of cultural element within talks and things too. So I think, putting yourself a little bit out your comfort zone and taking on some of those roles to be able to put our voices forward is really important. And I think it takes us a little bit longer to be able to be represented in research and policy. I'm only just getting to that point now, but I can see that it's happening, which is, I think, really a positive thing going forwards. I think what my career's taught me, both as an academic and within our research and within our communities, is that we need to talk about suicide in South Asian communities, because if we don't talk about it, it's just like it never happens. I know a friend who died by suicide in her early 30s. And to today, I think the community all think that she died from a heart attack because her family didn't want to share the reason for her death. I only knew because I work in the field. And it's not something I'd share either. But I think it just shows the stigma that's still associated with suicide. And we need to kind of be able to talk about it, to be able to reduce the stigma and promote people getting help. And I think by sharing stories and getting permission for that, it really helps. And I've seen it within the research that I've been doing, as I'll talk about when involving people with lived experience. So just looking at some of the research, obviously I'm an academic, so I should present some of that. So just some of the risk factors, which, they're not only for people from ethnic majority backgrounds, that these can be across all communities, but I think they're really prominent within, our communities. So cultural and social pressures, the stigma, honor that we've always got to abide by, gender expectations. I've just come from another meeting where they were talking about menopause and women and why they don't exercise and why maybe people from cultural backgrounds don't get involved in research. And I was trying to explain about all the expectations that are on us when we leave the office. Our work doesn't stop at 5 o'clock when we leave. We then have a lot of family commitments, whether it's as parents, as daughter-in-laws, sister-in-laws, wives. There's so many things. And even if you're not in a partnership, there's other commitments that will be placed on you within the family, financial as well now, because we're working women too. Structural barriers, we've still got systemic racism. I've definitely come across unconscious bias a lot in my career. I don't think I would necessarily say that some people are purposely being racist, but I think some of their actions, if they actually looked at them from my lens or people from ethnic minority lens, they might realize why they could come across in that way. And there's a glass ceiling, but I think it's even tougher for us to get through. And I've been on academic trainings for leadership, and I think it's really important, actually, that if you do want to progress in this career, to go on all of those training courses, the opportunities, Aurora, and other trainings that are for ethnic minority staff as well. And I went to the Aurora training, which is for women. And on the last day, on the last talk, they said, so things are changing and things are getting better for women. And it was like, oh, this is positive. But then they finished with, except for women of color. And I was like, oh, God. So again, it just felt like, we've still got so many kind of barriers to face to be able to progress. And we do have to, I think, work that little bit harder, unfortunately, to be seen and be heard, be taken seriously. But it can be done, as I'm proof of that. So yeah, we've got to get through those structural barriers without feeling uncomfortable. Interpersonal and emotional challenges, we've got a lot of issues within our communities. Domestic violence is rife. In some families, people are related, so it gets even more hidden. When I worked with South Asian women in communities where domestic violence was evident, a daughter might tell her mum that this is happening to me at home. I'm being raped, I'm being abused. But the mum was like, well, I can't say anything because I can't say anything to my family member whom you're married to. And it just added extra complexity of where people were kind of trapped in their situation. And that's what we see as one of the big risk factors for suicidality, unfortunately, when people do feel like they're trapped. Sorry. We've also got the migration stress that can intensify the emotional burden. And I've seen this with a lot of friends I have who've moved from abroad. Especially they may have moved abroad because they've got married to someone. Either they've moved together as a couple or they've married someone from the UK. And there's that added stress of not having as well your family around you, and how you may be treated under those circumstances. And then within work, you've got kind of the academic pressures, financial constraints, and that isolation that I just mentioned before, where you've got the feeling that something's happening, but you can't bring it up because then you might be worried that, you might get pushed out of your job and things. So I think it's knowing how to navigate some of those issues. I've co-written a book chapter on suicidal behaviour and socio-cultural factors among South Asians in the UK. I'd say the factors that have been highlighted in there haven't really changed dramatically, but hopefully we're moving in a direction to change them. I've just listed some here. I'm not going to go into them all because they're quite similar to what I was just saying before. But I think the biggest thing is the hidden burden and the underreporting of a lot of things that are going on still today. And then needing culturally informed prevention, having those safe spaces for people, and involving people from our cultures in our research, which I will show an example of. And obviously, thinking about prevention and what it looks like for our communities. That's what my work is all about, is kind of prevention, and rather than waiting for things to happen and then reacting. So being a lot less reactive, and thinking ahead and having rapid access to appropriate community-based services or interventions for people from different backgrounds. So I started this slide by putting the hidden struggles of South Asian women, and then I added in academia, because I thought this all actually relates to working in academia as well. But pressures of success. When I got a PhD, my family didn't really know what that meant. They thought it was great that I was called a doctor, but obviously to them, really, doctor mainly relates to clinical work. And so I think, I'd say sometimes I've got to miss a wedding because I need to write up my thesis chapter, and it was just not done. It was like, you can't do that. You've got to be there. You've got to represent the family. And I think just those kind of cultural barriers we have when we're also trying to succeed in our careers is really tricky. And, you'll go to the wedding, you'll go and do your bit, and then you'll come home and be working till 3 o'clock in the morning trying to finish your chapter, while potentially being a mother at the same time. So it's those kind of things you're grappling with all the time. And then, as I mentioned before, that kind of doesn't think about some of the challenges that we have and the cultural expectations, especially as a wife, as a mother, and within our caring roles. I mean, today I'll get phone calls from, my in-laws or my own parents, and it's like they never remember that I have a job and that I'm in work, and they want you to answer their questions there and then. But I think that's just one of those things that we kind of learn to navigate. I'd say one difference I've made is I have spoken about a lot of these experiences. I have spoken about the challenge. I've brought up the cultural expectations. When I'm applying for grants and things and they ask for other circumstances, I will bring up, I'm from an Asian family and I do have these extra responsibilities. So I'm conducting my research under that climate. And I do think it's important to highlight that. And I think it's really important to involve South Asian women in research. So a lot of my friends in the community or people I've met at school, I've got Nahid and Saika here on a slide. They were the first two I involved in the breast cancer research. And the clinicians could not believe how much they informed what we did within a breast cancer research program. And the things that they brought into the room about, all your messaging doesn't make it clear that these clinics are run by women and there's only women clinicians. Something simple like that. Then they informed changing all the messaging for the letters that went out to women about having breast checks and things. So just really, anecdotally, something simple can really make that much difference. So just to kind of start to summarize, I think building hope through community empowerment for suicide prevention is something I'm really involved with, and in academia. So training community workers, universities and healthcare teams about how we should involve everyone in our work, creating safe spaces where South Asian women can speak openly. I think this group is a really good example of that. And I think it's a really good idea, whoever put this together. So well done. And I think by centering culture and identity and belonging and, making that really obvious that we're doing that, I think is actually a really good thing for my work in suicide prevention and for all of us who are working in academia. And just finally, I think just finding my place in academia, it's been really difficult because I think, like I say, I was brought up in quite a white environment, and I think personally that's been a real advantage for me, because I've managed to gain a lot of confidence and skills from from the people around me, whether it was my friends, their parents, who are professionals. And even in work, I've never felt intimidated to go and talk to my senior leaders, no matter what race they're from. And that's one thing I'd really encourage is don't feel like you can't go and talk to people just because they're not like you. Go and speak to them, challenge them. I actually think they quite enjoy it and they welcome it. And also put yourself in situations where you are leading. Go and say, I do want to lead a group. And you'll probably do it really well and bring loads of new ideas and fresh thoughts as well. So I think that's helped me find my place in academia. It's gained me a lot of respect, and I think it's helped with my promotions as well. I think representation matters. I've won awards, which I think has been really important, but seeing ourselves as leaders, I think we have to do that. And using that recognition once you do get up the ladder for others, I think is really important. I've had so many young Asian students come up to me saying, "Oh my God, you're a professor. I could be a professor." And you know what? That really means a lot when they say that. So that's been really good to see. I didn't realize it would have that effect on other people. So just to finish with, I think, we've got to work together to break the silence. Speak openly about the issues within our communities and to help our communities. And yeah, just keep hoping. And as Rushmi mentioned, I do a podcast called Let's Talk Hope. And my next series is actually focusing on South Asian lived experiences. And I feel like finally I'm coming back to my roots, which is really exciting, that I can hopefully start to inform policy and practice. I've now been invited to speak nationally to influence policy and practice for suicide prevention. And as a South Asian, I know I can bring in a lot more to do with ethnic minority groups as well, which would be really good. So that's it from me. I'm just going to stop sharing and find where you all are. So yeah, I went a little bit over.
No, fantastic. Thank you so much. That was brilliant. It was really nice seeing your journey. And I've always, seen you on LinkedIn, you being a professor, and I'm just absolutely amazed. So it's lovely to hear how you got to where you are. What we're going to do is maybe if we ask in the room first, does anyone have any questions for Pooja? If you do, maybe raise your hand, use your microphone.